Hi, good morning, Cassie. My name is Mihiraa. Let's start the warm-up session. Why did you choose to become a nurse?
There are several reasons why I chose nursing. First of all, many of my relatives are nurses, and their stories inspired me a lot. Besides, nursing is a profession with an ocean of opportunities both native and abroad. Above all, this is a service-oriented profession in which I can serve humanity. Hence, I chose nursing as my career.
What is your career goal after reaching your dream destination?
Right now, I do not have any clear management goals. I am very interested in learning about management and leadership and would be interested in any committees that I could participate in and learn. I have lots of ideas and would love to be in a brainstorming group, and I am very interested in the management dynamics of the organization. I feel that I need to join leadership groups to learn and meet new people.
Describe your typical working day.
My day starts with prayer. After completing my daily routines, I reach my workstation by 7:30. Before taking the handover, I complete my inventories and update the crash cart medication and dressing trolley. After receiving the handover, I interact with my patients to identify their health needs. Based on my assessment plan, a nursing care plan, and provide quality care for my patients. Afterward, I assist the physician in his work and carry out necessary clinical orders. Meanwhile, I find some time to interact with my colleagues and maintain a good rapport with them. My duty ends by 3:30 after I give a handover to the next scheduled staff members.
What are the current trends in your profession?
Nursing is a dynamic profession and changes happen daily. Nowadays, technology plays a vital role in my profession. For instance, paper records that we used in the past have been updated to electronic records. Besides, at present, we are following evidence-based practice, which means there is a scientific rationale for every procedure. Moreover, in the present day, a nurse can function as a nurse practitioner, which is equivalent to the position of a physician.
How do you handle the stress of the job?
To handle the stress of the job, I prioritize self-care and seek support from colleagues and loved ones. I maintain a healthy work-life balance by scheduling regular breaks, engaging in activities I enjoy outside of work, and practicing stress relief techniques such as mindfulness or exercise. Additionally, I make sure to communicate openly with my colleagues about any challenges I'm facing and seek their advice and support when needed. Taking time to decompress and recharge allows me to approach my work with renewed energy and focus, ultimately ensuring that I can continue to provide the best possible care to my patients.
Your preparation time is over. You can now start your role play.
Good morning. Please, come in and have a seat. I'm Renson Huston, one of the nurses here. May I know your name for the records, please?
Good morning. My name is Mihiraa.
Thank you, Mihiraa. Could you tell me what brings you to the health center today?
Well, I've been getting these persistent headaches, and they're really starting to bother me. I thought I should get them checked out.
I'm sorry to hear that you've been dealing with persistent headaches, which can really wear you down. It was wise of you to come in so we can look into this together. To begin our assessment, I'd like to understand the nature of your headaches in more detail. Can you describe it in detail?
It's mostly a dull, constant ache. It doesn't really throb. It feels more like a tight band squeezing right around my head. I feel it mainly across my forehead, and sometimes it spreads to the back of my head and neck. The pain isn't so bad that I can't work, so I'd rate it about a 4 or 5 out of 10. It's just always there in the background.
Thank you for explaining that so clearly, Mihiraa. Do you experience any other associated symptoms?
No, I don't feel sick at all, and light or noise doesn't make the headache worse. The only other thing is that by evening time, my neck and shoulders feel really tight and stiff. And my vision has been completely normal, with no issues there.
All right. Now I have a clear picture of the headache itself. So let's explore what could be bringing it on. Mihiraa, can you tell me about any possible triggers you might have noticed?
Yes, I recently changed jobs. It's been really stressful, honestly. The workload is much higher, and I'm staring at a computer screen for 8 to 9 hours straight without many breaks. I've also been drinking a lot more coffee just to get through the afternoon slump.
That is incredibly insightful, and thank you for sharing that. A demanding new job, significantly increased screen time, and a higher caffeine intake are classic triggers for tension headaches. It sounds like your body has been holding on to that stress without you even realizing it. Mihiraa, please don't worry. This is a very common condition, and it's your body's way of telling you it's been holding on to too much tension. The good news is that there are things we can do right away to help ease this discomfort. For immediate relief, you can take an over-the-counter painkiller like paracetamol or ibuprofen, but it's best to use these sparingly and only when the pain starts, not continuously. Alongside that, some practical everyday remedies can make a real difference. Make sure you are sipping water regularly throughout the day because even mild dehydration can silently trigger a headache. Since you mentioned long hours of screen time, setting a timer to remind yourself to take short breaks every hour to stand, stretch, and rest your eyes is very effective. And finally, a simple relaxation technique like deep breathing, slowly inhaling through your nose and gently exhaling through your mouth for a minute or two, can help release that tightness in your neck and shoulders almost instantly.
Those sound like small, manageable steps. I can definitely try the timer and the breathing exercise. The pain is really just a nuisance. I can function, but I'm worried about how the stress is affecting my health in general.
I'm really glad those steps feel manageable for you, and I want to acknowledge how wise it is that you're thinking about your overall health, not just the headache. That concern shows great self-awareness. To protect your well-being long-term, let's focus on building some protective habits around your work stress. Creating a clear boundary between work and personal time is essential. Perhaps setting a firm time in the evening when you switch off from emails and work thoughts completely. Even a brisk 20-minute walk a few times a week can work wonders for clearing stress chemicals from your body and lifting your mood. And please don't underestimate sleep hygiene. Going to bed and waking up at consistent times helps your nervous system recover properly. Before we move on, do you have any concerns or questions?
That makes sense. I think I can try to be more disciplined with my bedtime. My main concern is that I don't want these headaches to become my new normal.
That's a powerful statement, and you have every right to demand better than just living with pain. That's why it's so important we have a clear safety plan, so you know exactly when to seek further help. I want you to contact a doctor if your headaches get worse despite trying these remedies, or if they suddenly become very severe and feel completely different. Also, seek urgent medical attention immediately if a headache is ever accompanied by a high fever, a stiff neck, confusion, or any numbness or weakness in your face or limbs. Those would be warning signs that need an emergency review.
Okay, I'll watch out for those signs. I feel a bit more in control now, having a plan.
I'm so pleased to hear that. You've given me a very clear picture today, Mihiraa. Let me summarize what we've discussed to make sure we're on the same page. You have persistent, moderate headaches that feel like a dull, tight band around your forehead and neck, which I believe are stress-related tension headaches. The main triggers are your recent stressful job change, long hours of screen time, and increased coffee intake. We've agreed on immediate relief using paracetamol sparingly, staying hydrated, taking screen breaks, and trying deep breathing. For long-term management, the focus is on setting work-life boundaries, getting regular physical exercise, and improving your sleep hygiene. And finally, please remember to seek medical help if the headaches worsen, change suddenly in severity, or come with a fever, stiff neck, confusion, or numbness. You have a solid plan to start with.